Hi, I'm Jamie. I'm 26 and currently a senior podiatrist based at National University Hospital.
And I'm Iru. I'm 30 and I'm a senior staff nurse in community nursing at Changi General Hospital. I actually find myself liking the work I do more with each day that passes. And yes, in a pandemic, it's even tougher. When COVID-19 first broke out in Singapore, I was deployed to the migrant worker dormitories to run mobile medical posts and administer swab tests for the foreign workers. During that period, I moved out of my family home and stayed at another place with a friend also doing COVID work to minimize the risk to my parents. But I don't regret going through the experience. I actually view it as an opportunity. It gave me the chance to work with medical and non-medical staff from different ministries and organizations. And the support from my friends, family, and then fiancé and now husband was unforgettable.
I'm leading the MOH Inpatient Podiatry Unit, so one of my challenges during COVID-19 is having to adapt quickly to new rules and guidelines at the front line. I was tasked with seeing COVID-19 patients who had feet issues to prioritize them based on urgency. I had to make sure they got the care they needed quickly. Another challenge is encouraging patients who need help managing their wounds to come back to the hospital. They tend to stay away for the fear of getting COVID-19, but we need to prevent them from having a future amputation or a loss of life due to infection.
That nurses only provide patients with basic nursing care. We do more than that. It's just as important to be a listener, an advisor, and an advocate. Sometimes our patients and their caregivers just need to know that we are there for them and they feel reassured and less fearful.
When I first joined healthcare, I thought that all patients just naturally want to get better. But not all patients actually want our help. So, we really need to get to know them better, find out what motivates them in order to persuade them to go through the treatments they need. Taking up the scholarship gave me some experiences and insights, even before I left for my studies. There was a healthcare induction program where I met and bonded with other scholars, and we learned how each of our own skill sets would contribute to patients' care. I also got to see what I learned at school put into practice when I came back for a mid-program attachment during the school holidays. When I graduated and started working, I got to attend conferences and networking events. These conferences are also the times I get to bond with friends I have made in the healthcare over the years. We shared our struggles, we brainstormed on how to cope, and we improved our industry together.
During my undergrad days, the scholarship gave me the opportunity to travel to countries like Cambodia, India, Indonesia, and China. There, we did humanitarian and medical work for various communities. These experiences really opened my eyes. I realized just how much my healthcare knowledge and skills could impact people's lives, especially in places where healthcare is just not affordable or easily accessible. This really motivated me to become a community nurse, so I can help patients bridge that gap between being cared for at the hospital to caring for themselves at home.
I got to pursue my Bachelor's of Health Sciences and Master's of Podiatric Practice at La Trobe University in Australia.
I got my Bachelor of Science in Nursing at National University of Singapore after my A-levels. And thereafter, I completed my Advanced Diploma in Chronic Disease Management at Ngee Ann Polytechnic.
If you want to make a difference in people's life, this is a scholarship worth considering. Do as much research as you can. Speak to healthcare professionals like me, and try to get the opportunity to shadow them in their jobs. This scholarship and this sector will challenge you and bring you lots of new opportunities.
I realized that the knowledge and skills I've gained go beyond caring for patients who come through the healthcare facilities. I'm very thankful that my general surgery nursing background has enabled me to care for my dad when he was battling cancer. It also really brought home the advice a mentor once gave me to care for every patient as you would someone you respect and value, and to do unto others as you would others do unto you.